Did you know that approximately 70 to 80% of your immune system resides in your gut? This powerful connection means that your gut health plays a crucial role in managing skin conditions like acne. Research now reveals that a healthy gut microbiome can positively impact skin clarity and reduce inflammation, highlighting the importance of a healthy diet and good digestion in achieving radiant skin.
Welcome to the Spa Doctor podcast, where we uncover the secrets about women's health and hormones.
I'm your host, Dr. Trevor Cates, naturopathic doctor, best-selling author, and founder of the Spa Doctor. Every episode, we reveal the best-kept secrets for achieving glowing skin, natural beauty, a healthy body, and a balanced mind. Are you ready to live your healthiest life? Keep on listening. I'm Dr. Trevor Cates. Welcome to the Spa Doctor podcast. Join us on today's episode as we unravel the intricate dance between your gut and acne, uncover the magic behind food and flawless skin, decode the complex relationship between hormones and your complexion, and tackle the surprising connection between menopause and acne. Plus, we explore the ways aging and hormones can change your skin and what you can do to support graceful aging. Our guest today is Dr. DeJarra K, who specializes in natural treatments for acne, psoriasis, eczema, and hair loss. With over 15 years of experience, Dr. Sims combines her medical expertise with her passion for holistic healing to help patients achieve clear, healthy skin. She is the founder of Superhero Skincare, a virtual naturopathic clinic dedicated to providing personalized, science-backed skincare solutions. Dr. Sims is also a former professor at Bastyr University, an accomplished speaker, and published author. DeJarra, it's so great to see you and have you on the Spa Doctor podcast. Welcome.
Thank you so much for having me, Dr. Cates.
So let's dive into skin. And you and I have known each other a while, and we see similarly when it comes to skin, which in a lot of ways with doctors, it's not the case. So certainly with conventional dermatologists, it's all about what we put on, the procedures, those sorts of things. But you and I have a different approach than dermatologists, that we really look on what's happening inside the body in addition to what we're putting on the skin, right?
Skin grows from the inside out. So we have to heal the inside first. Absolutely.
Yeah. And some of the things that I know you talk about are hormones, gut health, food. Those are some of the big things that impact our skin. So let's dive into these. Where would you like to start?
Oh, I feel like hormones are the thing that people have the biggest problem with. But we can start wherever, because food is directly always the issue, right? Is acne, are my skin issues related to food? But what I see mostly online and what I've seen in a lot of Facebook groups I have joined is women have hormonal skin issues. They have hormonal skin issues when they're teenagers, when they're in their 20s and 30s, and then going into perimenopause and menopause. So I think we should probably start with hormone, because that's a big topic and we might run out of time just talking about that.
It is true. And hormones are so important to talk about when it comes to skin. So with all the changes that women go through, what do you see? And you have private practice, and so you actually see people. They walk in, and maybe I know that a lot of people have been surprised. Women come in and they say, I thought acne, for example, was a thing from my puberty or my early years. Why am I experiencing it now? So what are the things that you actually see people walking in with?
They are walking in with, and this has been even increasing over the years, as you're seeing women from the ages of like 45 to 55 and up to 60, where they're like, why do I have acne? And I never had it as a teenager. And they're like freaking out because they're like, this is a teenage disease. Why all of a sudden am I having acne? And that's when they're just like, listen, I know I'm on the end of this thing. And then I find out their periods are too long. And they're just like, oh, I'm supposed to be perimenopausal, but my period is coming every couple of weeks, or instead of every 4 weeks. And it's lasting 7 days and 10 days. And they never had any skin issues before, whether it's acne. Sometimes hair loss, of course, is coming with hormonal changes. So just looking at the whole of the holistic part of it, you're having mood swings, you're having insomnia and sleep issues. And then all of a sudden, women in their 40s are getting acne and they're freaking out. And that's what I'm seeing.
And so can you explain about the hormonal changes that cause women to break out during this time?
Yes. So what's happening is you're seeing women who their estrogen and progesterone are slowly declining, but their testosterone is either staying the same or it's increasing. So a lot of times their hormonal acne is due to excess androgens. So androgens are being the male hormones, DHT, DHEAS that we measure, and testosterone. And it's staying steady, and those female hormones are plummeting. And that shift in that fluctuation is causing them to have acne. Now, other things can just be, of course, just a shift in progesterone and estrogen in their relative balance. So even estrogen being too high in people that are gaining more weight and their estrogen is fluctuating and then their progesterone is dropping. So it's just the fluctuation of all the hormones, but mainly what I'm seeing is that progesterone and estrogen are going lower and their testosterone is going higher. And women are not treating it properly. They're going to doctors who are giving them more progesterone and then their estrogen is still low relative to their testosterone. So they're not getting a change, right? Because it's the fluctuation and they're either just giving progesterone or they're giving them testosterone and making the problem worse. It's really interesting how they're being tested and then getting on creams and pellets and troches of different hormones, but the testing isn't really showing what's actually going on in them.
Yes. And it's definitely a different approach that naturopathic doctors, functional medicine doctors that work with women and hormones have versus conventional gynecologists, or because it's the blood work, right? So we're testing blood as a more conventional, and then functional and naturopathic doctors are doing specialty lab testing that gives us more information. So do you want to talk a bit about that, of like how you really look at those hormone levels differently?
I do. A lot of times, one of the biggest things, and I actually was just talking about this in another conference, is I love that people get their hormones tested because at least you have some concrete evidence. But when you look at estrogen levels in the blood, there's such a wide range. And you'll look at one and it's like, oh, from 52 to 285 is normal. And you're like, wait, what? Like, how do I know? Like, and then it's falling somewhere and people are like, but I don't feel like my estrogen is normal. I don't feel like my progesterone is normal. So the ranges aren't really accurately showing us. It's showing us if there's disease, but the ranges don't show us optimal function. So that's why when we do like this naturopathic, this functional testing, it gives us like a bit more information, more detailed look at what's actually happening with the hormones. Are they too high, too low? Are they in the optimal range? Are we looking at adrenal health and the female and male hormones as well as thyroid? Like you can just do a thyroid level, but are you looking at everything? And we just have a more holistic approach. And when you look at everything, you can see which hormones are low, which are high, and are you processing them through your liver properly? Because sometimes hormones are fine, but people are having issues detoxing. They have some type of genetic defect like MTHFR or some other kind of defect where they're literally just not breaking down hormones properly. And so when we look at the whole person, we can figure out what actually is going on and treat the root cause. And I think that's the best way to describe our approach. We're really figuring out, well, why do you have low estrogen? Why do you have low progesterone? Yes, you might have perimenopause or menopause, but what else is going on? How can we support the body?
Yeah, absolutely. And everyone is so different, right? Every woman, as we go through changes and these transitions, we go through it differently. And so that's why I think what you just said, because someone listening to this is might think, oh my gosh, this is so complicated. Hormones or others. She just mentioned a bunch of different hormones I don't even know about. But what it boils down to is those root causes and what's triggering those imbalances, and maybe also some genetic predispositions we might have, and addressing those. So when it comes to helping women that have, because some women just go right through menopause, just their period stop, and that's it. No big deal.
Right? That's the way it should be. I would say you want to dance gracefully into menopause, not go crashing down. And a lot of people do, but then there's a big portion of people who do not. And that has them going on the bioidentical hormones, and then they do that for years, and that helps a little bit in the short run. But I've seen people in their 80s being like, I want to get off this now. And then I'm like, okay, now we're back to what's happening when you were in your 40s, like that we treated the bioidentical. Now we're going back and still having to fix the root cause.
Absolutely. And my mom was one of those women. She's like, what's the big deal? It just, my period stopped. It was like, no big deal. Why are all these people complaining about it? So it is kind of funny because we hear a lot about the women that are really struggling with these symptoms. A lot of women having symptoms that have no idea that it's even related to perimenopause. And maybe they're in their late 30s, early 40s, and they're going, what? Peri what?
Period shifting. Like you're starting to have a decrease in your hormones. And what comes along with that is brain fog and decreased energy. Sometimes you get hot sweats in the day and night sweats. People have irritability, mood changes, mood swings. Hair loss is a big thing that I see. And then the hormone shifting with the skin changes, right? So all the skin stuff, whether it's acne or reoccurrence of eczema rashes and things like that you haven't dealt with in years. There's so many different things. Increased weight gain, the inability to gain weight, all of that. And people are just like, well, I have these different things. And they're just like, oh, I'm overweight. I got to get on this diet. Oh, I'm not sleeping well. Let me take this pill. Oh, I'm not, like, I have hair loss. Let me use this Rogaine. Let me use this. And it's like, no. Let's stop all that. Let's get to the root cause. Let's figure out, yeah, there are some things that are going to happen. And we want you to gracefully transition into menopause, go through perimenopause, and have as minimal symptoms as possible. And I think that is possible with naturopathic medicine, whether you're doing supplementation, mind body counseling, botanical medicine, herbal. There's all kind of different modalities that naturopathic doctors use to help you not only just alleviate the symptoms, but actually get through those symptoms. Whether you're a young woman, because I know we're talking specifically about perimenopause and menopause, but even women that are in their 20s, to help them alleviate those symptoms, that they don't have to deal with that hormonal skin and hormonal acne changes. And then also women dealing with perimenopause and menopause, where they can decrease those symptoms, eliminate them, and then gracefully transition into menopause, where they're not feeling awful, where they can't think. They always feel like they're a shadow of their former selves. I hear a lot of women saying it's like, I'm looking down on my body and I'm not in control of what's happening. I can't control my mind. I have these thoughts, whether it's depressive thoughts, whether it's irritability, anger, anxiety. And they're just like, I hear and see myself having these thoughts, but I can't address them. And that's all hormonal imbalance. And we can fix that with naturopathic medicine very, very easily.
Yeah, amazing. So let's talk about some of those things in naturopathic medicine that you do to help women balance their hormones, whether it's these symptoms that you talked about that are maybe the sleep and the weight and the mood, but also acne. So what are some of the tools in your tool belt?
Oh my gosh. So I actually had this question earlier, and I see it on social media a lot. People are always like, well, what's the best supplement for acne? And I'm like, well, it's depending on why you have it, because there's so many different reasons, right? So when we go into looking at acne, we also want to look at the gut health. So I do want to start there. Do you have a healthy gut? Like, are you pooping 2 to 3 times a day? Are you drinking enough water? Are you eating good veggies? I know it seems simple, but that's the basis of naturopathic medicine. Are you drinking water, eating vegetables, and pooping? And then we go into, are you sleeping well, right? And if you're not sleeping well, what are the things that we can do for sleeping well? There's an array of supplements. I know that you're well aware of all the supplements we use, but I've used things like ashwagandha to help with sleep. But then I also use things like phosphatidylserine, depending on, are they having issues with sleep because of high cortisol levels? What are the reasons you're having like problems sleeping, right? So we still have to get to the root cause. And when we look at that, establishing the foundations of health, it's like, are you sleeping? Are you pooping? Are you drinking water? Are you getting fiber and vegetables in? That's like number one, right? So I start there. And then we figure out, as the dust settles, what else can we do? Are we testing hormones now, or are we going straight into environmental toxins? It's just depending on what's happening with that individual. You said that each individual person. So I'm looking at the individual person in front of me, and we're starting with the foundations of health, like all naturopathic doctors do. But then we also look at the individual person and say, okay, well, what are you needing? What are you missing that I need to give you?
Yeah. So with gut health, what besides some of the things that you just mentioned, like drinking lots of water, like drinking plenty of water, making sure you're going to the bathroom regularly, getting fiber. What are some of the practical things that people can do to really help their gut health? Because you and I know that just even if someone has having regular bowel movements doesn't mean that their gut health is perfect. That skin is one of the biggest indicators that the gut is not on track. I've had so many patients that have said, yeah, no, my gut health is fine. I go to the bathroom regularly. I eat healthy. And then, but they have skin issues and we do gut testing and
Exactly. It's not. And that's why I do gut testing. So you hit the nail right on the head. I will test their gut. So my approach is definitely very hands-on. What is it that you come here to see me for? And then I address that. And then I still go and do what I need to do. I'm still going to test their gut. But I always want to make sure that they are feeling heard. So when people come in, they're like, oh, my gut is healthy. I'm fine. And I'm like, oh, okay. I know it's not, but I'm like, okay, well, let's talk about these other stuff. And then I teach them why we still need to test their gut. And then when we look at the gut health, we generally will see that there's some good bacteria missing. And I see that a lot in patients with skincare issues. They have zero of the good bacteria. The lactobacillus is down, their bifidobacterium is down, and we have to put them on a good probiotic. It sounds very simple, but if you don't have good bacteria, we got to give it to you. And that's what I end up doing with most people. Yeah, there are some times we have to kill off bacteria, and that's when we use our antimicrobial herbs. And there's so many different bacteria and viruses and fungus. You see a lot of candida. I know, I'm sure you've seen that as well in the gut that's overgrowing. But you go in with that good bacteria, and it really helps to balance out the gut microbiome. And when we talk about microbiome, for those who don't know, it's just the good and bad bacteria that are living in our gut. They're supposed to be in harmony. And sometimes the bad bacteria outgrow the good bacteria, and that causes disruption and inflammation in the body. So it's one of those things where we have to balance the bacteria out in the gut. And if we don't have that balanced bacteria, that's what naturopathic doctors call disbiosis. And when we're treating disbiosis, it's like making sure that the good bacteria and bad bacteria are in balance. And so probiotics, a really great probiotic that's broad spectrum, or at least that's covering the things that you're missing, it's the main first go-to for patients for me.
Thank you for bringing that up. And the gut dysbiosis is so crucial when it comes to addressing not only hormones, but also skin health. And in addition to having the gut microbiome, we have a skin microbiome, right? And I know that you know a lot about this as well, and that direct connection between the gut and the skin and the microbiome. If you have gut dysbiosis, you probably have skin dysbiosis too, right?
Your products matter. What you're putting on your body matters, right? The best example is how when we take antibiotics, it wipes out all of our gut flora. The same thing can happen if you're using really crappy skincare products on your skin. You can destroy your skin barrier by disrupting the good and bad bacteria that are living in harmony on your skin. And so you see a lot of people dealing with skin barrier issues. Their skin is too thin or not holding in moisture because they've disrupted their skin microbiome.
And so we've talked some about hormones. We've talked some about gut. So how about food? Let's talk about food. What are the foods that people really want to focus on? And I mean, I generally think there's really no such thing as a bad food. It's just everybody's individual. And I know that I've heard you talk a lot about this on Instagram. Yeah.
Yeah, absolutely. I completely agree. I think that's one of the biggest things is that people are like, well, Dr. DJ, I've been gluten-free, dairy-free for 2 years and my skin is still bad. And I'm like, yeah, it's probably kale or spinach. That's the problem because food sensitivities, they're such a individual thing. And people are sensitive to foods based on what they're eating when their microbiome was having inflammation and destroyed. So whenever you are having gut health issues, most people are just eating whatever they're eating. And then all of a sudden, because they have what people term leaky gut or intestinal hyperpermeability, they will then develop food sensitivities. So I've met people who have severe sensitivities to gluten, dairy, eggs, soy, right? The top ones. And most people, if they remove those and decrease their sugar, can have clear skin. I've seen that happen time and time again. People are like, oh, yeah, I had a more plant-based diet and then I got better. That happens. It's just like those people going to menopause. Good majority of people don't have problems when they remove dairy and they remove gluten. And there's a lot of people who remove that and they still have problems. And that's when we go into testing to see what specific food sensitivities they have. And then we can remove those. And that's more individual, like naturopathic medicine. That's what I feel is the best approach.
Okay. So there's not like a list of foods that are the ones that are that you think are the biggest triggers. You think it's just really individual?
I do think it's individual, but all the research shows it's like gluten, dairy, sugar, eggs, and soy. Like those are the five. And you can try, like, the cheapest, easiest way to see is to just remove those for a couple of weeks to see if your skin gets better. And it is gluten. Gluten and dairy are so problematic in the majority of people. It's just that there's a subset of people who they're fine. Like my mom eats cheese and milk every day. No problem. That beautiful baby boomer lifestyle. Like she's like, they were eating healthier foods. She's like eating cheese all the time. She's like having her cheese toast in the morning, a little slice of cheese with a snack with carrots and grapes. No skin issues. Beautiful. And I eat a piece of cheese and I'm gassy all day. Like everybody's individual. She's never had an issue with dairy and she's never had skin issues. And I meet people like that. But you can pinpoint that gluten and dairy and all of these things. And when we say gluten, it's wheat products processed here in America, to be exact, because the gluten is not a problem for a lot of people when they go to Europe. And every time I have a patient go on vacation to Europe, they're like, I ate all the pasta I wanted without any skin issues and no gas and bloating. So I am very specific. Wheat processed in America is very problematic. Be careful. Remove gluten, remove dairy, decrease your sugar and white sugar completely if you can, and try to eat more vegetables because we know that we need to get fiber in order to have really great bowel movements and help with the microbiome. And those are those things that I would say. However, if that isn't working for you, because you remember when we see people as a naturopathic doctor, I'm seeing people that are on the bad end of the spectrum. A lot of them have already done that. So then the question is, if you've already done those things, if you removed all of that, we have to then go and look deeper into their gut microbiome and do food sensitivity testing.
I think that's so important because you were just talking about your mom, baby boomer generation, and then our generation and how our gut health is just different. And it's a different time. We were raised on a lot of antibiotics, and there was antibiotics put in our food. There was hand sanitizer, major hygiene phobia to the point where it disrupted our gut microbiome. So now our generation and our children and their children, probably the shifting and the changes have made us more susceptible to food sensitivities. Because I know a lot of people are like, well, why can somebody eat it? It goes back to that gut health and our digestion and what can we do to support our gut health? So I think that's so important because we can't just look at food alone, right?
I look at it like this all the time because there's so many younger women who I treat, especially the girls in college. They're just like, why is my friend eating pizza and hamburger and she's drinking every night and her skin is gorgeous and mine isn't, and I'm vegan, I'm vegetarian, I don't have any sugar in my diet, I haven't eaten gluten in 2 years, and my skin is horrible. And that's when I always say, let's get specific with you. Let's do some microbiome testing. Let's see if you have some big bad bug that we need to kill off. But also, like, let's look at your hormones, because then the hormonal acne, those hormonal shifts cause skin issues. So it's not just solely about diet. It's about your hormone balance. And they're all together. Like you're one whole person. And you can't just say, well, I have this great clean diet, but you've also were on birth control for 20 years and then you got off. Well, yeah, you're going to have skin issues because you've been taking hormones and now you don't have them anymore. And I've seen people get off of birth control and have gut issues. So it's all the same thing. Like we have to support the whole body. And so I don't like telling people there's one way to treat skin with digestion, because yes, I can tell you to do probiotics. We can get you on fiber and get you eating all the vegetables in the world. but we have to look at your individual health and what is going on in your body in particular. And I think that's the beauty of naturopathic medicine, is because, yeah, we can have some protocols and there's some things that we all learn. But at the end of the day, if that doesn't work, we have more in our tool belt and we can dig deeper and see what your difference is. And we won't dismiss you and say, well, oh, that's just a variation of normal. Like, no, it's not normal and it's okay. We can figure it out. And that's what I love about naturopathic medicine.
And it's the more people that know about this, the better, because really it is empowering to know that you have control over your body more than I think a lot of times people are taught. And that these symptoms that you're having, it's okay. But it doesn't mean that you should suffer through it.
Absolutely. I agree. And that's why I named my clinics. I was in a brick and mortar practice, and then I moved my practice to virtual, and I call it Superhero Skincare. And the reason I call it there is because I wanted to empower women to take their health into their own hands, understand what's happening. And I really lean into that doctor as teacher, that docere, which is a naturopathic principle. Like, I want to teach you what I know, break it down into words that you can understand so you know your body. Because as a human, we all need to be empowered to understand what's going on with our health so we can make informed health decisions. Because there's a big trend to just be like, well, this is right and this is wrong and this is health and this is not. And I'm like, yeah, but we don't know. Like, each person is individual. So you know what? If you want to take a more integrated route, that's fine. But let's understand the consequences of using medications. Let's understand the side effects of this supplement, as well as understand the side effects that come along with taking medications. I am not anti anything when it comes to someone's body. What I am is I'm pro-health. So I'm going to teach you everything you need to know, and I'm going to help you make a decision that you're comfortable with. And I think that all doctors should be that way. And that's how I try to practice, because it's an empowerment of the individual that makes me feel like I'm actually being a good doctor. It's empowering the person to take control of their health and feel responsible. And then also it takes the pressure off me, because now they're making a decision that they feel good with, and I'm not forcing them to do anything.
I do think it's a change of perspective in these days that we don't look to doctors as like, they're just going to tell us what to do and we're going to do it. I don't think that people are looking for that as much anymore. We want to make the healthcare system more efficient and free up more time for doctors to have quality time with their patients and to be there to help, not tell you what to do, because AI can do that. You can Google stuff and you can get all kinds of advice, but do you have the care with your healthcare provider that you need, right? Are you feeling empowered like you do, DeJarra?
Absolutely. I agree 110%. That's because AI could replace us all, but it cannot replace having someone in your corner that actually believes that you can be empowered to make good, healthy decisions. And there is just some gaps in Googling. It's like Google that talks to you, Google that talks back. It's like AI is there, and I'm sure it's going to enhance and be better. And who knows, one day there might be a whole Android doctor somewhere with lasers and all kind of stuff fixing, but we're not there yet. And really getting back to that root cause medicine, people want that. You can see it. Everyone's like making their own sourdough bread now online. People have gardens. There's always going to be a space where people just want someone who's going to sit down and talk to them and explain to them like they're a human, not talking down to them. That's another thing that I hate in medicine that exists. People belittling people and demeaning people and making them feel like they don't know what's best for themselves. Like inherently, I think we all know what's best for ourselves, but we don't all have the same scientific background. So I feel like that's what I bring to the table. It's like, listen, you know your body and I know medicine. Let's put our heads together and come up with something that is going to make you the best person, the best version of yourself health-wise, right? And I think that's what we bring to the table that AI cannot do. And I love that for us having AI as a tool that we can use. And people shouldn't be afraid of it, I think, but I think we need to learn how to use it to better ourselves.
I just appreciate your positive perspective on that. And I think we all need it. So I do have another question for you around, you touched on this a few times. I just want to ask, with hormonal changes, in addition to acne, what are some of the other skin issues that women might experience with hormonal changes, especially perimenopause, menopause, postmenopause, those transition times?
Dryness and loss of collagen. That's it. Dry skin, loss of collagen. So we have like sinking eyes, wrinkles, all of that is collagen loss. And so, and that hydration, that plumpness in the skin, that's the biggest things I see, that dry, flaky skin, the loss of that plumpness, and then, lack of collagen causing more wrinkles and sagging skin and thin skin. And so one of the best things you can do is hydrate, moisturize, good moisturizers for your skin, and taking collagen. I like collagen. It is a little problematic when people are like vegan or vegetarian and they don't want to do collagen because most of the collagen is not plant-based. However, there are some ways to get that in using amino acids and things like that. They call it vegan collagen, but it's really not collagen, but it is the protein and the building blocks of collagen. So just making sure you're getting in amino acids and protein is really helpful for that.
Well, it is empowering to know that there are things that we can do. It's just, we have to be a little bit more proactive. It's not that we just have to settle with premature aging. We can age gracefully, right? Which is having a little bit of extra support with things.
Yeah, and there's nothing wrong with that. And I think that there is a society that's out there that's making women feel not good about their skin and their wrinkles. Look, wear your wrinkles if you want, but if you don't want to, you don't have to. It's fine. There's room for all of it. I am such a middle of the way doctor. I think that makes me not as popular on Instagram because I'm not anti this, anti that. I'm like, listen, you can be wrinkly and beautiful, or you can go get those wrinkles taken care of in whatever way you see fit. Just let me know if you're my patient so I can like ward off the side effects, because it's, once again, it's empowerment. And how am I going to tell you that you need to be feeling beautiful with wrinkles if you don't want them? We're in a day and time where you don't have to do anything you don't want to do. If you don't want wrinkles, you don't have to have wrinkles. But what you can do is be proactive and get the right skincare products. You can make sure you're hydrating your skin, that you're using collagen, that you're being proactive and doing all the things to decrease and minimize the amount of skin thinning and wrinkles that you have. And so you don't lose that plumpness in your skin. And that starts in your 20s, ladies. Like, you need to start it now. There's still hope for you if you're in your 40s and 50s. But listen, anyone in their 20s listening, start now. Don't wait until you're just like, I have crow's feet. What do I do? Like, just start it now. You don't have to have crow's feet to moisturize your skin and use really great products, right?
Amazing. I love your perspective, and I love that flexibility and that inclusivity. That, I think we need more of that. And I do agree that social media and media in general is all about the extremes, one extreme or the other. And there's room for all of us. We're all in this human thing together.
Absolutely. There is room for all of us. And I promised myself, I never wanted to be that kind of doctor that disempowered my patient because I had a staunch belief on something. Like, my beliefs are my beliefs, right? And as a doctor, once again, it's empowerment. And I can tell you my opinion. I can tell you the science. I can tell you all the side effects, the pros and cons. I can tell you what I do for me if you want to know that, but it's my personal story. I can tell you what I like to use, but at the end of the day, I'm going to give you all the information and we're going to make informed healthcare decisions. And whatever that looks like for you is empowering, that's what you need to do. And that is something that we deal with women all the time, is because we're so talked about, like, every aspect of our lives. You see how celebrities are being talked about, like they'll get Botox. They're doing all these things to make themselves look good. And I'm just like, first of all, you should have had a naturopath and you wouldn't be having this problem. But okay, now that you've done that, get a naturopath so we can help you with those side effects. There's no reason for you not to have a naturopath and doctor in your area. We can help in every aspect of, like, whether you want to do it, not do it, or if you already done it and you need us to help you with the side effects, we got you.
Okay, so main takeaway number one, get a naturopathic doctor.
Absolutely. I can actually tell someone how to do face masks at home and give them a recipe, or tell them the products I like. Like, I can do all kind of things. I can help people if they want thousands of dollars worth of skincare and they want me to point them in the right direction to a clean product line. But at the same time, I can tell someone, hey, you can do this clay mask at home. Here are the things that you need. Let me show you what to buy. And that's the range that we have. And we're able to help people in so many different aspects. We can simplify your skincare. We can give you more extensive skincare regimens. We treat from the inside out. So I'm giving you what your skin actually needs. I always tell people I help you grow healthy skin. That's my thing. Like I tell you, I can refer you to different products and I can refer you to different supplements. But at the end of the day, what I do is I help you grow healthy skin from the inside out. And that has to do with realigning your body, establishing foundations to a healthy body, right? Establishing the foundations of health, making sure that your body has everything it needs, that we can actually detoxify out everything that we don't need, and then give your skin what it needs, right? Because there's stuff that your body needs in general, and we have to support the organs, right? If your thyroid's low, we can't just give you skincare products and you have hypothyroidism. That's not going to work. We still have to treat all the things. And then I can also then go in and say, here's some skincare, right? So we do the inside, but we also can treat topically and do things specifically for your skin.
So amazing. I know when I started doing this, focusing on skin, there were so many naturopathic doctors like, why would you do skin? That doesn't make any sense. We do so much more. But it's
all reflected in the skin.
Yeah. Well, skin is our magic mirror. It gives us great clues about our overall health. So we definitely want to focus on that too. Well, DeJarra, this has been so great to catch up with you and love your enthusiasm and your wisdom. Can you tell everyone where they can find you, learn more about you?
Absolutely. You can learn more about my clinic at www.superheroskincare.com. My patients call me Dr. DJ, so you're totally fine with calling me Dr. DJ. If you can't pronounce DeJarra, that's fine. On Instagram, I'm at Dr. DJ Sims, and that's DOCTORDJSIMS, 1M, Dr. DJ Sims, and it's Dr. DJ Sims also on Facebook. But if you go to my Instagram, you can find all the other handles there.
Great. Thank you so much. It's been so fun.
It's been so fun. Thank you for having me. Have a good day.
Thanks for joining me. If you found today's episode enlightening, please consider sharing it with a friend or tagging someone on social media who could benefit from these insights. And don't forget to follow us on Instagram and subscribe to our YouTube channel to stay updated on our latest episodes and behind-the-scenes content.
Thank you for listening to this week's episode of the Spa Doctor Podcast. See you next Sunday for a new episode on your journey to living your healthiest life at any age.